We, the epidemiologists, Christian, Jacob, Ashima, Kathleen, Thon, and Chelsea, will explore the prevalence of the Zika virus amongst pregnant women in the United States in the last 10 years. The extent of the problem reaches out to a vast amount of people. However, the Zika virus largely affects pregnant women because it can determine the survival rate of their baby. There is a lot of quantitative data that suggests that the Zika virus is a problem in the United States. According to the Centers of Disease Control and Prevention, CDC, there has been 5,074 Zika virus disease cases reported in the United States and 38,306 Zika virus disease cases reported in the U.S. territories. Furthermore, from these cases alone, there have been 1,534 cases reported amongst pregnant women in the U.S. states, and 3,225 cases reported in the U.S. territories. The cases in the United States and District of Columbia with pregnancy losses with birth defects were 5, while live-born infants with birth defects were 47, and completed pregnancies with or without birth defects were 1,143. The numbers here show that the Zika virus is prevalent and is a problem in the United States. There is a high prevalence in Brownsville, Texas, and South Florida, where the CDC advises pregnant women to take precautions. According to the World Bank, the estimated cost for the Zika virus in Mexico is $744 million, for Cuba it is $644 million, and for other areas it is $1.08 billion. In addition, the World Bank states that it would cost the world a total of $3.48 billion for the Zika virus. There are no reports on the United States in relation to the Zika virus. However, the countries show that there is a large cost and economic burden. This is a large amount of money that is being used on the Zika virus when it is preventable, and we as epidemiologists can prevent this virus from spreading to pregnant women who are highly vulnerable to this disease. In addition, the cost to care for a child throughout their lifetime who has developed microcephaly from the Zika virus are unimaginable. This is a map of the states and territories reporting the Zika virus from the CDC. As seen on the map, the dark shade of blue indicates that there are more cases of the Zika virus. The light shade of blue indicates a lower rate of the Zika virus. The incident is seen to be higher in California, Texas, and the East Coast states. It is important for pregnant women to refer to this map when traveling so they could take the necessary precautions when dealing with the Zika virus and its harmful effects. Signs and symptoms of the Zika virus. The agent for the disease is a virus. It's part of the flavivirus genus. According to the World Health Organization, the symptoms for the Zika virus include mild fever, skin rash, conjunctivitis, which is also known as pink eye, muscle and joint pain, malaise, or headaches. However, majority of the individuals who get infected rarely show signs or symptoms. So it is important for pregnant women to be aware that the Zika virus exists and get checkups when they travel. For babies in the womb, possible birth defects include microcephaly and congenital Zika syndrome.
Modes of transmission and health factor. According to Center for Disease Control and Prevention, a mosquito bite is the mode of transmission of the Zika virus. There are some modes of transmission. The infected mosquito bite people during the day, especially early morning and late afternoon evening. Contact with blood or bodily fluids of an infected person, such as sexual intercourse or blood transfusions, and mother to fetus during pregnancy is known as direct transmission. There are host factors of the Zika virus such as people and mosquitoes. Among the hosts are the people who live at infected area will have the highest risk of contracting the Zika virus, and pregnant women have the most negative consequences of contracting the Zika virus. This is an infographic from World Health Organization, and it is to explain what is Zika virus and what symptoms when people get infected. Levels of prevention. There is some way to prevent the problem even though the vaccination have not been created yet. The remarry prevention. Protect themselves from the mosquito bites. Help the citizens and travelers from getting infected in the vulnerable area. Rub and spray mosquito repellent in their body, clothes, and house in infected area. In addition, for someone who travels, especially pregnant women, should plan ahead before traveling to humid areas and countries where there is a higher chance of them being infected. The secondary prevention. After traveling from infected countries, the travelers should go to the doctor to test their blood and urine to find out if they got infected with Zika virus. The other way to protect it from the Zika virus is wearing condom during sex. In the first week, infected people should not stay at home because their most significant other could get infected by the same disease that the person has. This is how Zika virus spread. The infected mosquito bite people and infected people can transfer the virus to other people during pregnancy, sex intercourse, and flush transfusion. So we need to know to protect our family and community. To pregnant women, the laboratory testing and regular fetal ultrasound are recommended to check the baby's health, and they also should follow procedures of prenatal visit. The tertiary prevention. Currently, there are no known vaccines that can immunize mass population and escalate the preventative steps to combat and cure Zika. However, those infected with the virus and experience side effects such as rash, joint pain, and or rest eyes can take medicine to ease these symptoms. They also should follow doctor's direction, drink plenty of fluid, and get rest. This is a testing algorithm for a pregnant woman with history of travel to an area with Zika virus transmission with the clinical illness consistent with Zika virus disease. Reduced from CDC.
With regards to environmental factors, there are two major topics we can talk about: geographical and individual. With geographical factors, we must consider the number one transmitter of Zika, mosquitoes. Now, their environment consists of moist areas such as lakes, marshes, swamps, and puddles, which are most popular for their breeding grounds. You also must consider the location of the house or occupation. Now, if your house or your job is close to these environments, and you have an increased exposure to these mosquitoes. The other topic would be individual factors, such as the lack of education. You could be unaware of the different levels of prevention and will not take the precautionary steps in order to protect yourself from contracting the virus itself. And finally, if your mother is the carrier, now there's not much you can really do about that. Now this map shows areas where specifically the species carrying the virus, the Zika virus, are globally. And as you can see, the majority of the areas are around the equator, which are very warm areas such as Africa or South America or even southern parts of Australia.
The figure shows Zika countries with transmission. The red shaded area shows widespread transmission in the past 3 months. Yellow shaded area shows sporadic transmission in the past 3 months, while blue shaded area shows past transmission between 2007 and 3 months ago.
Now there's also a temporal variation of the Zika virus, and this relies heavily on the mosquito season. It's been studied, and there's actually been a direct correlation between mosquito season and the increased incidence rate of Zika. As you can see on the chart on the left, it shows the increased incidence rate of Zika virus in the Caribbean spiking between the months of May, June, and July, whereas the chart on the right is a mosquito season in the Caribbean compared to the one on the left, matching up exactly with the months of May, June, July, and August. Now, although the Zika virus has been studied for years, there's still things that are unknown about it. For instance, it could be linked to other congenial or immune system illnesses, such as microencephaly or Guillain-Barré syndrome. With regards to the population, people are still very unaware of the characteristics of Zika. Many people do not know that it can be transmitted sexually, and further education must be given to the population on the symptoms, treatment, and places to get tested.
Since the reemergence of the Zika virus, it has been declared a major public health threat. Zika has been spread throughout different countries, territories, and areas. There is a call for a multifaceted response that involves public health leaders and researchers, as there is still uncertainty regarding the virus's vectors and pathogenesis inside the body. Concurrently, the diagnostic guidelines for Zika have not been fully established yet. Also, laboratory testing is not yet consistent or available in most areas where Zika is most prevalent. There is a need for epidemiologists to define the range of the virus vectors and find places where mosquitoes cause the most transmission. In conclusion, it is critical that funding go to projects that researches ways to prevent the spread of the Zika virus. Preventing the spread of Zika will help reduce maternal mortality, infant mortality, and infant morbidity caused by an infection in pregnant women. Infant mortality is often used to describe the health of a nation. Zika outbreaks are still ongoing and extremely hard to predict how the virus will spread over time. Also, getting rid of Zika will also take care of dengue fever as well, since both are transmitted similarly through the same mosquito. There is a need for funding for Zika since there is currently no vaccine or antiviral treatment available. Also, women may not be able to start families without worrying about birth defects and infection caused by Zika. The virus has the potential to infect a new generation of babies and will affect populations and communities throughout the world.
Zika virus is a disease that can spread amongst your host through mosquito bites. The mosquitoes that are responsible for the disease comes from the Aedes species, specifically the Aedes aegypti and the Aedes genus. According to the World Health Organization, the Zika virus is prominent in areas such as Asia, Americas, the Pacific, and Africa. These areas are most favorable for mosquito to thrive because of the warm temperature, heavy rain, and moist environment. A stagnant water that is produced from rainfall or other bodies of water can become a suitable habitat for the mosquitoes to breed. The virus can infect anyone, and not only can the virus be transmitted through mosquito bites, it can also be transmitted from pregnant women to their child through sex and blood transfusion. The issue with Zika virus reaches out to a copious amount of people, but there is still a higher risk for pregnant women and their child. Since the virus can be passed down during pregnancy, the virus can cause birth defects to the child. People have been infected with the virus and experienced symptoms such as skin rashes, fever, joint pain, headache, and discomfort. The symptoms are closely related to infections like dengue. Unfortunately, the Zika virus does not have any known vaccination. However, there are types of prevention one can take as a precaution to the disease. Even though Zika virus does not have any known vaccination, there are types of prevention one can take as a precaution to the disease. Educating people about the risk of traveling or living in areas that is considered to have an active site of Zika virus is an example of primary prevention. Secondary prevention can include travelers going to the doctors and getting their blood tested to see if they have the virus. Lastly, if a person has passed the pathogenesis of the disease and are already infected by it, tertiary prevention occurs. This prevention is devised to lessen and ease the effects of living with Zika virus. The research to find a vaccine for Zika should be funded because this could alleviate the infant mortality and morbidity. Without a cure for the virus, families will struggle from the effects of Zika. Lastly, if a vaccine is discovered, this can improve and change the overall health of a country that is struck by this disease.
Because of the recent Zika outbreak, it is important for the public health sector and health education to inform the general public of its implications. First, the public should be aware that there is currently no vaccine available. This makes the general population susceptible to transmitting the disease. Necessary precautions to take, especially in the case of pregnant women, are to protect the skin from mosquito bites, take necessary blood tests to screen for infection, and by using contraceptives such as condoms to reduce sexual transmission. When expecting mothers understand the possible birth defects implications, such as microcephaly, it becomes a priority for these soon-to-be mothers and healthcare providers to protect the child. Educating healthcare providers and the general public is beneficial to reducing the risk of infection among the target population of pregnant women. As healthcare providers continue to educate their patients about ways to protect themselves, we are able to reduce risk of infection of a larger part of the population. Having less infected people in the country reduces risk of spreading disease and increases the quality of life. Throughout our presentation, we have included a few of the following epidemiology terms. Incidence rate describes the rate of development of a disease in a group over a certain time period. Indirect transmission is where infection is spread through an intermediary source, such as a mosquito vector. Direct transmission is contact with blood or body fluids of an infected person, such as sexual intercourse or blood transfusions. Primary prevention are activities designed to reduce the occurrence of disease that occurs during pre-pathogenesis or before an agent interacts with the host. Tertiary prevention occurs during late pathogenesis of the disease and is designed to reduce the limitations of disability from disease.